Ready. All right. Good afternoon, everyone. I'm Jen Barbarack, the Executive Director at the Beale Regional Health Foundation. Our mission is to identify and address the diverse healthcare needs in our community, and it's our intent to help our region's school nurses further their education in topics that are important to them. So that is why we've created these lunch and learns, and they're specifically for our school nurses. So I want to thank our partners in the presentation today, Penn State University and Dr. Joan Humphrey. Joan and I worked together as registered nurses many years ago in the ER at Sharon Regional. And Joan was also a school nurse, and Joan has since become a nurse practitioner. Congratulations, and works for Primary Health Network. She's also a certified nurse educator at Penn State University. And today she's going to talk to us about ADHD and depression in the school children. So I'm going to go ahead, turn it over to you, Joan.
Thank you so much, Jen and Donna. I appreciate the opportunity and welcome the school nurses to a contact hour on today's topic, which will be ADHD and depression. And today we are going to give you the disclosure form for Penn State contact hours. This activity will earn 1.0 hours if you stay throughout the full program and complete this a very short evaluation at the end of the program. We are approved, and it is with distinction, and that does matter, as a provider of nursing continuing education professional development by the Pennsylvania State Nurses Association, and they are accredited to approve the American Nurse Credentialing Centers Commission and accreditation for these contact hours. None of us as presenters for this educational activity have any relevant financial relationship to disclose at all with any ineligible companies whose primary business is producing, marketing, selling, or reselling, or distributing any kind of healthcare products used by or on patients. So that's kind of an important disclaimer and a disclosure for you to keep in mind. I do this as a volunteer because these topics are very near and dear to my heart as a provider now, and out of my sincere and deep respect for nurse practitioners and nursing in the school setting, the hard work and extra work that you've been given to do is just incredible. May is Mental Health Awareness Month, and I do want to say that 1 in 4 people will suffer from some form of mental illness in any given year, and that how important it is for us to be aware of not having pain be identified just as a physical ailment, but how nursing always addresses the body, mind, and spirit holistic care of an individual. So for the agenda for today, I do want to say, sorry, my mouse is giving me some trouble here. We do want to understand the effects of depression and ADHD on the school-age child. And in particular, I wanted to talk to you because in my practice, I have seen several adults even that have the dual diagnosis of depression and ADHD. As many of you know, ADHD is one of those diagnoses that doesn't ever seem to, it stays with you for life. So depression can be then a compounding and confounding diagnosis in the ADHD person. And the nursing role, and especially for school nurses, the role we have in facilitating positive mental health outcomes in student populations that can carry on all the way through adulthood. School nurses are absolutely vital to student health. And, we typically think of the school nurse as the asthma inhaler, the EpiPen, we're going to help students get their blood sugar readings before lunch and get some insulin. But I want to say that being on the front line the way we have been through of these past couple of years, especially how hard it is to focus on promoting wellness. We do more than just manage these chronic diseases and administer medication and address issues that affect the student in and out of the classroom. As a provider, I am now seeing the bigger picture where school nurses may be, with the exception of getting those immunizations to get into school, the only healthcare provider many of our young people ever come in contact with. We have people that get the shots, get them in school, and that's the end of it until they need that that tetanus shot to get, at the age of 12. So you're it. You're the link. So I give you a lot of credit. The focus today I wanted to try to give some time to is the prevalence of mental health problems and how it's increased in the school-age child and adolescent population. These problems with mental health have become a large part of the school nurse's workload. It's not just the administration of the, running from building to building to get the height, weight, eye exams done in, the odd numbered years or however it's now being done in the school setting. Mental health issues have really taken over a lot of the nursing care and the role of the school nurse. If you ask yourself this question, this was a pop-up that doesn't seem to work on my work computer, but it's a poll that I wanted to take with you. And you don't have to answer this in the chat or anything, but I would like you to say, to tell me, and to ask yourself, do students really feel like they can talk to you about the problems that affect their mental health? This happens frequently, or no, the students are very reluctant to discuss the mental health issues with me as a school nurse. We see populations that are really reluctant to even admit. I have people that come in their teen years that say, I don't want anybody to say that I have, that I have these problems. They are taught to stigmatize these from even very young ages. It's very sad. But if a student is willing to talk to you, do you even have the time? And we'll talk about that coming up. Without nursing services, attendance would decrease in the school setting. Students would be unable to attend school. We see kids sleeping on their desks like this young man is. The job of a school nurse has become what the National Association of School Nurses calls the hidden healthcare system. Your role as school nurses offers life-saving care to students across the whole country. And again, it may be the only time a young person actually sees a healthcare provider. So I want to recognize you today and your role, because you are a link for those of us that want to try to help support you. The pandemic fallout on mental health has been unbelievable. Research is ongoing, as you know, regarding the mental health effects of the coronavirus disease on children and adolescents. The toll was that we are reading about and hearing about, and you've lived through in the school year this year, the isolation, loneliness, lack of physical activity, the family stressors of everybody being in isolation, social inequity that contributed to the effects of the coronavirus disease and the pandemic that's ongoing and not over yet. And then we do know that early studies have shown that children and adolescents are no different than us adults that had increased anxiety and depression as a result of this. Jen and I were just talking about some of our colleagues that we know for sure had this significant change in their own mental health as a result of the trying to help people through the pandemic. And people that actually, no matter how vigilant they were with the vaccines and boosters, still got and masking and hand washing, still became ill from the pandemic. And it's happening right now, this very minute. I just got off the phone with a hospitalist at a local hospital that told me my place is packed with this. I worry about the adolescents a lot, and children too, of course, but mental health services and access to that care is really critical. And so females, we do know for sure in adolescents have an increased need to have mental health services, or even just someone they can confide in. We do know that many children feel unsafe with regards to the pandemic. They had somatic symptoms that, like, my stomach hurts, but they couldn't identify that it was because they were afraid from what they were hearing from adults, or, the pandemic news was just frightening to them. Parental stress and mental health problems, people that lost their jobs, all of those things have taken a toll on the children and their mental health and adolescents. Medical and behavioral health professionals really do need to be more aware of screening for depression and anxiety in our children, no doubt about it. So counseling, is it present in your school? This was a poll that we were hoping to do, but I would like you to just answer these questions to yourself. No need to respond in the chat. As a school nurse, do you have time to actively listen to problems that children and teenagers may feel that they're having? Or do you feel like you have to cut them short because you have so many duties? Because school nursing, as we know, has been pared down to absolute bare bones clinical staff. And I wonder if you're even able to perform some of the duties that are being placed on you. I worry about that. Access to mental health care alone is increasingly important, but the reality is referrals may take months to get appointments scheduled. And so we see a big need there and a big gap where nurse practitioners or providers, school nursing, nurses in general, families call on their nursing relatives to ask for advice. And we are more and more being demanded to understand more about depression, ADHD, the dual diagnoses that go along with a lot of these problems. And then knowing right off the bat that school funding, schools are not really funding the school nurse role adequately for counseling services to be added to the role of the school nurse. And I'm sure many of you will agree with me because we know there's a gap. The diagnoses of ADHD, we know, is a mental condition that includes inattentiveness, could be hyperactivity, impulsivity. Depression is a crucial symptom of ADHD, and I don't think people realize how often these diagnoses go hand in hand. The child with ADHD struggles with serious symptoms, but they're not always diagnosed with both. So they end up with a really less optimal outcome and a disappointing life. Depression is a very serious, as we know, but common mental illness. In situational depression, it can be major depressive disorder. There's like 10 different diagnoses in the DSM-5 that actually fall under depression. And so I always try to make sure people are aware that it can be related to a situation. It could be a lifelong thing. It could be, they don't say dysthymia anymore, or dysthymic, where people are just like down in the dumps all the time. It is, as we know, on the cellular level, a problem with serotonin levels, the neurotransmitters in the brain that are not functioning at optimal function. And then there is the end result of depression that can lead to such grave situations happening. as suicidality or negative thoughts, sleep patterns. These things affect children, even in seeing it in a parent, and affects their sleep, their dreams, and then as a result, you get them in the morning for school. Not only are the children hungry and we're worried about feeding some of them, but then we are worried with the unknowns that they are not verbalizing or that we may not even recognize. So the background I do want to say to you is the World Health Organization says about 20% of children and adolescents worldwide, I mean, almost a fourth really, can experience mental health problems. And a lot of these start before the age of 14. Mental health problems in a school-age child can involve a broad spectrum of suffering. It could be anxiety. It could just be, a one-day thing, 1 week thing, one situation thing. But it can go into many other advanced forms of self-harm, depression, and lead to substance abuse and eating disorders. I think if we could catch a lot of this early on, the substance abuse, eating disorders, we talked about that in one of our past lunch and learns. Some of these things could be maybe headed off at the pass, if you will, if we could see it and catch it early. I do bring in suicide because they did finish up the most recent youth risk behavior survey from 2019, and it did say that about 9% of kids in grades 9 through 12 made an attempt in the past year. That is a lot of kids. And so that is a survey that is collected and counted and calculated. So 2019 was the beginning of our situations. This is like before the pandemic actually occurred. Female students, as you know, are more often, as much as 2 times more likely to attempt a suicide. And then 2.5% of students making a suicide attempt had to be treated by a doctor or nurse. So a lot of this is just under the radar. We're missing a lot of this. And multiple race students seem to be affected in larger numbers than we realized or recognized, as reported in the youth risk behavior survey. I do want to show you that it is an increasing problem, and the age group that we're looking at here is really, it did go down a little, before the pandemic, and then after the pandemic went up in the group that we're talking about. So this was a CDC, and I have this all documented if you need references at all. I want to talk to you a little bit about this dual diagnosis that we are trying to bring some information to today with our talk about the ADHD. And this happened this week, where people are getting, pre-adolescent kids are getting not diagnosed maybe. It's impulsive aggression. This happened this past week in a school district, I believe. This was in Tennessee, where the child was arrested by the police and handcuffed. And you see this more and more, where they're coming right into the school with police presence and arresting children. This child is, I believe, 11 years old. Affective aggression, it's characterized by a strong, unplanned emotional outbreak, usually anger, and it's an action that takes place in the heat of a moment. Children with ADHD do experience different emotions with greater intensity than their peers without it. And ADHD can also include and incorporate other DSM-5 diagnoses like panic attacks and anger, mood disorders. And it can be connected, and some kids with ADHD experience frequent outbursts of anger. It's common, but these intense emotional breaks can make it hard for a child to maintain their friendships. And once this happens to a child where they're arrested like this, in handcuffs and taken out of the school in front of all their peers and families then get involved, and children are no longer allowed to play with these children. There's all this social implication that happens to these kids when an overt situation like this occurs in the school setting. This child apparently did strike a teacher, and that was the cause for the arrest to be made. Emotional outbursts in kids with ADHD are more prone to happen, as we talked about. These kids are very impulsive, unstable, and they are easily frustrated. They get excited, impatient. Sometimes they can't control their behaviors at all. They get annoyed or angry, and they are clearly different and stand out already from the other kids their age, with differences in the physical and intellectual development. And these kids are displaying, the majority of them, way more than half, up to 70%, have this impulsivity, and it's an emotional thing. Sometimes emotions are very labile, where they're crying and almost laughing at the same time. They're just very highly impulsive and emotional. And these things happen that are really indicative of depression in this child that may not be diagnosed. Sudden dramatic changes in mood, as we said already, and they can't control these emotions. It's called emotional dysregulation. They have physical issues where their weight is changing because they're in childhood. Those 8-year-olds that all of a sudden are becoming very chubby or pretty plus as little girls, starting their periods in 3rd and 4th grade. Weight loss, weight gain can be one of the warning signs of a mental health disorder such as depression. When you see these things happening to the child, sometimes we don't even associate the fact that there's a mental health diagnosis that may be confounding that. Headaches, body cramps, fatigue, digestive issues. The nurse's office are always full of these kids with, my stomach hurts, my headaches, I have cramps, and those kinds of things. And we're not seeing the big picture sometimes. Signs of depression, of course, are very overt, with the extreme sadness, unhappiness, really hard to see them smile or laugh. Nothing can make them happy. And then, of course, depression is talked about sometimes, about taking their own life, or you'd be better off without me kind of statements. A lot of things we see are related to a low phase in their life, but may not have anything at all to do with the child. It has to do with the family life situation, where financial issues in the home are concerned, or mental health issues and drug issues could be in the parents, but it's manifesting in the child, and they're not even able to identify that sometimes. The dual diagnosis with ADHD and depression is that we see there's negative thinking. They don't have positive, they have physically lost the ability to say positive things. They have negativity inside of them, and it's just the way they respond, and it's not able to be overcome without some sort of behavior therapy. Socially, they withdraw because they are isolating themselves, because they know they're different. They know they're not feeling the happiness that some of their friends are feeling. They want to live in their comfort zone. The symptoms are the fact that they have trouble sleeping, they're not paying attention, they're falling behind in in their schoolwork because they're always tired. Children laying their head on their desk at school could really be a symptom of this situation where they have depression. And because they're on a medication like Ritalin or some sort of stimulant, not always using a stimulant any longer in today's world, but an ADHD medication, people don't think that they can have depression because of the ADHD and the hyperactivity or impulsivity diagnosis. These kids are often overlooked as being some of these symptoms where they are having depression, because the opposite is typically what is manifested in ADHD. If that makes sense, you might need to think about that for a minute, but it's really the opposite of what we're typically thinking when we have an ADHD hyperactivity kid. For some children with mental health problems, a school nurse can be the life-changing link that they have, because you're a safe person that they know likes them. School nurses, I applaud, because they are always there for the whole student body. And that office is like an oasis where the students can go. It's quiet. There's someone who's interested in them. And if you have mental health issues, the nurse is going to ask you questions about how you're feeling. And a lot of times kids just leave little hints that may be able to be expanded upon by the school nurse. We know that healthy students are better learners, and we know that the school nurse is likely to be the one person that's trusted. This is the last part of this, and I do want to thank you for joining me today with this talk. I do have any information to help you through the summer months. If you want to learn more about this topic to earn more CEUs, you can let me know. And I thank you for joining me. I'd like to open the floor up to any questions that you may have. And I appreciate your time.
Donna, if we could stop the recording. I know Megan is still on. I'm not sure if she has somebody. Sometimes they have people in the office with them and they can't